see? Does this feel like this?
No.
Still over tender over here?
Mm-hmm. Yeah, right where you're at.
We got some clavicle first rib stuff to do right here. Some sternum work, clavicle, open this up right here. Ever getting numbness or tingles down there?
Yeah.
Okay.
Wait, what? Are you telling me that's what it's from?
Yeah.
Why would my leg also feel that sensation right here?
What?
I said I also feel that sensation right here.
Oh, tingling?
Yeah.
Okay, so we'll just have to look into the ligament right here. So as muscle, pubic bone, pubic ramline, if that hip's turned over here. Yeah, you said it was your right hip, right?
Yeah.
Okay.
What?
Normal. All good stuff.
What?
It's all good. I'm going to fix it. Okay, good. We got a nice flow here. Large intestine is good. Stomach, spleen, meridian is good. Thyroid, adrenal glands, also good. Lung is good, but it's interesting because you have sinus stuff, right?
Mm-hmm.
All right. It's not actually it's not cellular. It's not like the membrane. It actually is structural because of your nose, according to this. And then, let's see what the reflex points say. Terrible?
Yeah.
All right, this one's through the gallbladder, so we start here.
What?
And then the gallbladder point to reflex in the abdomen is 2 inches lateral. And then superior to the 6th costal arch. That right there. Nice, gentle breathing. We're just going to hold these spots until this tension leaves. Okay, now this one's better already, right?
Yeah.
That's better, but this is still here. All right, let me check the other reflex at the foot. Go ahead and put your right foot right here on your knee.
My right?
No.
My right foot.
That's tender, right?
Yeah.
See, now it's making all kinds of noise. Good. Let your belly relax. Good. Still a little bit left. Let's put that one down. And the next point is here on the third transverse process. There we go. Okay, nice gentle breathing.
I've noticed when my body's in pain, I stop breathing.
It's good awareness. 10 deep breaths every time you think about your breath. Just take 10 deep breaths. Really, you probably only will get 2 or 3, maybe 4 and then you'll get distracted without practice. To take 10 breaths in a row without getting distracted that's a sign of a developed mind.
That feels crazy. Ow. Also, whatever that is also increasing my body heat.
Good awareness. All right, not quite completely released yet. We have to go back to it. Let's check the pancreas. Terrible, right? Right there.
Yeah. What is your pancreas again?
What's that?
What does your pancreas do again?
It secretes insulin. Insulin release so you can break down sugars. Absorb sugars into cells, actually. It's a little sloshy over here. A little better?
Mm-hmm.
Okay, let that relax. Crappy.
Yeah.
Okay, this one's for the stomach. Let this hand relax. Almost. A little bit more, right? Is that better?
It's a little bit better, yeah.
There's still more in there.
My stomach's always an issue for me, personally.
Yeah, let me see. It's all in the small intestine. The colon is good. The large intestine is good. So it's all in the digestive tract after the stomach.
Yeah.
Before the colon. So
Yeah.
it's actually, so there's some absorption things there. Probiotics help with that. You can do some abdominal massage too. That might help. What kind of issue do you have? Do you have burping?
It's like mostly like I can't pass gas.
Okay,
Like I can't
you get
burp
stuck.
or like I can't fart sometimes, and like it feels like it's
you
stuck.
need to, yeah. All right.
Yeah, I always thought it was an intestinal issue. I just didn't know which one.
1, 2, 3, 4, 5. Okay. Let's do this. Put your thumb on top of your pubic bone right here. Tender on this side?
A little bit.
Is it tender on this side?
Not as much.
Which side did you say? Which leg got the tingles?
The right one.
All right, I'm going to adjust the pubic bone right here. Okay, so I'm going to contact your pubic bone with the side of my finger like this, or side of my hand. Good, and then as you breathe out, we're going to push in this direction like that. Good. Good. Let that relax.
What the fuck?
What?
What is that?
It's a ligament.
Why does it feel like that?
Because the hip is tight.
The body is so gross.
Don't say that.
I can feel whatever it is. But man, what the French toast?
Here, bend this right leg. Bring this down here. Okay, I'm gonna go a little bit deeper into the hip.
Oh my. That feels awful.
Okay, breathe through it. Good. Do a nose breath. Good. Good job, you're doing good.
Oh my gosh.
It's that right there. Feel that tension?
Yeah.
There it goes. Just relaxed. Good job. Right on that last breath, it let go. Ready? So here's what we're going to do. So what you're going to do is straighten out your knee and bring your foot up. No. Bring that back. Bring your foot up towards the ceiling.
This foot?
Yeah.
The one that's on my knee?
Yeah.
Okay.
Okay. Bring it up more.
Okay.
All right, now lower it down slowly. Good. Keep going. Just like that. It's perfect. Yep. Nice and slow. Almost there. Almost there.
Oh my god. My body. Yeah.
Well, let's see. Ready? I'm gonna repalpate this and see if it's here. Give me your thumb again. Okay, ready? Middle, right, left.
Well, your left, which would be my right, feels better, yeah.
All right, let's get underneath the diaphragm here. Pancreas. That's better. Okay, now we're gonna work underneath the right costal arch here. I'm gonna hold on to the trapezius muscle on the right. Breathing. Gonna let your stomach relax. Deep breath. Almost there. Hold it just like that. Don't let me pull it apart. Hold it tight. Okay, ready? Palatine, lip right, maxillary, nasal, zygo. So palatine on the right with a zygo on the right, or palatine on the right, zygo on the left. Tongue, thyroid, got SCM, occiput, sagittal suture, temporal on the right, sphenoid. Sphenoid's good. It's all right side, right temporal, right sphenoid, right palatine, left zygomatic.
In terms of like the sinus stuff, yeah, it is on the right side.
Mm-hmm.
When I broke my nose, this is the sinus that got I had like a rod put into it because I tried to like make the wall stand again.
Okay.
Yeah.
Oh, that's what your muscle test is telling me. It's all on the right. Okay. Relax.
I've never had sinus pressure before. I broke my nose.
Okay. So I'm saying it's all mechanical. It's not actually a sinus issue. It's
just how things are laying.
All right, close. First, we're gonna lift this zygomatic on the right side. Let's push this one down. Good. The breathing does the respiration does the adjustment. That's already starting to let go. Good. 2 more breaths. There we go. Good. Good. Now open your mouth. Okay, I'm going to go a little bit further back onto the Paresthesia bone. Okay, you can close your mouth.
My eyes water.
This is it right here. This is where all the tension is in your sinus. Good, we're going to hold this for a couple breaths. Okay, let me see. Just your smile.
Smile?
Don't bite me.
Don't. I just trying to understand why this works. Trying to understand why this works.
Yeah, because so it wasn't until like 20 years ago that we found out that the sutures of the skull and the cranium in itself are movable. Because for a long time we're just like, no, they're just plates and they're fused together and there's no motion. It wasn't until NASA was doing research on astronauts coming back from space and measuring decompression with very, very sensitive scientific equipment that's not used in medicine. And so they found out that not only is the cranium moving, but it's also moving with the breath, which validated what osteopaths and chiropractors had been saying for like at least 50 years to that point. And so the movements aren't like the spine where things crack and you have this big range of motion that allows for bending and flexing and things. The movements are just a very subtle expansion and contraction. And it all works with your breath. And there's 2 pumps, one at the occiput here and one at the sacrum. And those 2 pumps are responsible for circulating cerebral spinal fluid, which is the fluid that your brain and your spinal cord are bathed in and nutrients are delivered by.
So much spit.
All right, so I'm gonna do this now. All right, stick out your tongue. Okay, I'm gonna traction your tongue like this.
Uh-huh.
Okay, now we're just gonna hold that while we open up and release the tension here at the bottom of the jaw, thyroid. Okay, I'm going to do a slight variation of that. This time this works a little better, I think. Okay, stick out your tongue as far as it goes. Okay, I'm going to traction your tongue downward like this. All right, now try to let your jaw relax. You got a gag reflex?
Oh, that.
There we go. Did you feel that? It's a whole bunch of congestion. All the lymph vessels here. No, there's a ton of heat coming off of your neck and your jaw.
I'm so sorry. It's not you, it's my spit.
No,
It's my spit. Yeah, that's interesting. What the? Who would have thought? If I hadn't found you whatever I did last year, I don't think I would ever know what the hell's wrong with my body. So thank you for helping me figure out what's wrong with my body when doctors couldn't. So now I know that I'm not a psycho. I am a hypochondriac, but there's nothing wrong with my body. And now I know that I'm completely okay. They're just everything's all on one line, man, and it makes no sense to me, but he understands, so it's all that matters.